What's up, y'all? This is Carolina Doc PT, 13-year licensed and practicing doctor of physical therapy. And uh, today we're going with part two of this video series on icing and heat and how you can use these temperature-based modalities to help to heal an injury that you might have. So the first video we did was about icing and how you should ice and everything around that. And today's video, we're going to be talking about when you should use heat. So the with heat with ice, it's really never wrong to ice. Okay, so that's just kind of the rule of thumb for icing, unless you're talking about on a fracture or something like that, or unless you might be a person that's intolerable to using ice. Sometimes patients that have RA, like rheumatoid arthritis, things like that, sometimes they just can't tolerate ice. So, for those particular patients, and then also for patients who are having more chronic type of pain. So, this is going to be pain that you've been experiencing for a longer period of time. It's been lasting for longer than 48 hours. Um, those are the types of injuries and the types of pain that can benefit greatly from heat. Okay, so the benefit of heat and what you want to think of with heat. So this kind of goes from. We'll go back to the fire a little bit. So one of the things that after you've had an injury, your body is as you're going through the inflammatory process and the healing process that your body goes through after you've had an injury, or if you have like a repeated injury, um, you are the body is trying to bring blood flow in, is trying to bring oxygen into the area to try to help that area heal. It also is wanting to take away some of the inflammatory byproducts from the chemical processes that are happening due to the inflammation and due to the injury itself. So that's kind of like the fire that we have going. And so early on, you would want to kind of put ice on that to kind of calm that thing down. If you put heat onto that injury that's happening, that like after it's recently happening, that is like dumping gasoline onto a fire. So you're bringing more blood flow into the area from the heat, which is going to pick up that inflammation that's happening there. So, I mean, yes, you do need oxygen to come in with heat. I'm sorry, with the blood flow, but if you get too much, then you get a lot of inflammation that's happening. And that's where the problem comes in when you're using heat early on. So it is a big no no. It is a big, you do not want to use heat within 48 hours of an injury. After 48 hours, and and when you're at a point where you're experiencing, say, chronic pain, and this is going to be more like arthritic pain for these patients that I mentioned early on, these patients that have RA, rheumatoid arthritis, things like that, these people that don't tolerate heat, tolerate ice, they can tolerate heat. And for those types of things, those types of injuries, that chronic heat injury, that area needs is more blood flow because bringing oxygen in, like those areas are like more low grade type of injuries, or after like you've had a muscle sprain or an ankle sprain, after it's healed a little bit and after you've gotten beyond that 48-hour period, now the injury is not quite as bad, it's not quite as severe, and so now that's where us bringing more blood flow into the area via heat can be beneficial, and so that's what you would want to do for those particular types of issues. So that's the key with heat is you don't want to do anything. You don't want to put heat on within 48 hours of an injury. But then you want to put it on after that point. If it's this chronic type of an injury, I'll also say, um, let me separate out when we're talking about time frame though. Let me separate out surgical injuries, or not injuries, but surgical pain. Like, let's say you've had a knee replacement, you've had a hip replacement, and say you are, you know, 4 or 5 days out. So, yes, you're outside of that 48-hour window, and you're wanting to put heat on there. I would be cautious about that. So, yes, technically, could you? Uh, yes, feasibly. But you do want to think about what I mentioned in the first video. you still don't have a fully functioning joint there. So every time you move it, you're kicking up your inflammation. So essentially, you have this repeated lower level or lower intensity injury happening. So you do have a new injury repetitively happening when you move and work those particular joints. So that's where ice is really called for post surgical pain, going out, you know, like I would say probably about a week or so, and then week to 2 weeks even, and then maybe you can start using some heat at that point where then that would be more beneficial. But for all other things, and mainly we're talking about arthritis issues, this is going to be arthritis issues in the knee, the joints. Um, if you've had an injury that early on you were using heat for, but now you're past that 48-hour window um, of using ice, well now you can switch over to using heat, and that can be very beneficial because, as I said, that injury does need oxygen. It does need blood flow to come in, and by using heat, that heat is drawing in more blood, and so now you're helping to bring that oxygen to the area to help that area heal. Um, so heat can be really beneficial. I'll tell you this as far as heat goes, and I'll show you a heating pad that I like, or at least it's similar. I actually looked for the type that we have used in the clinic, and I couldn't find it for some reason. But this one is similar, so you get the idea of it. Let me pull it up. This heating pad is the one that is very similar to the one that we use in the clinic. Um, the thing that I like about this is one, it will not get. It has a temperature sensor there, so it will only get so hot. So you're not going to risk actually a burn with a patient. So that's what I like about this. It also shuts off after a particular a period of time. So it's very easy to control the temperature of this and kind of manage that. So the one thing that you want to really think about with heating pads is making sure you don't have a burn. But these types of electric heating pads are generally really good. So I would look at this one. As I say, this is the one I found that's $17. It's I don't have the one that we actually use in the clinic. I looked on Amazon for this, but for some reason I couldn't find one. But this is the one that's really the closest to the one that we use, and so that's why I am recommending it. So I will put the link for this particular heating pad in the show notes, and you can click there if you would like to purchase this from our Amazon Associates page. One of the reasons I was mentioning that I like about that particular heating pad is, and I think most heating pads probably have this feature on it now, but we use it for sure in the clinic because the in physical therapy clinics and outpatient clinics, the number one reason that physical therapists are sued by patients is because of burns. Um, Typically, that is because they are using wet heat. So there are heat packs that you can use that are in a heating device that has water in it. That's in a clinic that can get this heating device really hot. You put it in a particular type of towel that it's kind of able to control some of that heat, and then you put it on a person in the area that you're trying to work on, and it drives heat in. I actually, in our clinic, took over managing in this particular clinic. I actually got rid of ours because I was like, okay, we're not getting sued because people are using these things incorrectly. It's very easy to use those incorrectly, and I think that the heat that you can get from a heating pad, especially one similar to the one that I showed you, and the ones that's similar to the one that we use, is just as sufficient. It's just as good, and there's no need to risk. Why risk getting sued in the clinic because you've burned someone because you put something that was way too hot for what that person needed onto an area? It just makes no sense. So that's why I like those particular heating pads because the risk of burning yourself is much lower because the device has a sensor in itself that will help to prevent that. So that is one of the things that you have to be concerned about when you are using heat. Though, so I'd be really careful. Also, I'm only talking about those types of heating pads. I am not recommending using heat from any other source. Okay, if you burn yourself because you said, "Hey, I'm using heat and I got a hot poker out of the fire to put on my joint," hey, man, that's on you. I didn't tell you to do that. What I'm recommending is this heating pad here that I'm putting into the show notes, and so that would deliver some good heat that will help your chronic injury to heal. So I hope that that provided some information for you and maybe answered some questions that you may have had regarding when is it appropriate to use heat. There are certainly time frames for that, as we discussed. And oh, one other thing, I didn't talk about the length of time to use heat. In general, you're going to want to use heat for about that same 25 or so minutes. It's not wrong to use heat for longer than that. You certainly could, as long as it's comfortable. You could. I would probably be hesitant to go beyond about 25 minutes, but technically, there's nothing necessarily wrong with that. But in my recommendation for you, it would be more. I would use it for about 25 minutes or so, then take it off, let the area cool back down, or well, yeah, cool back down and get back to just a normal temperature for you. And then you can cycle through that again and do that like a few times a day. So that's about the recommendation that I would use for that as far as the length of time that you should use heat when you're actually. So I hope that this video has been informative to you and maybe answered some questions that you may have had regarding when is it appropriate to use heat. And this was the second video on this topic. They're actually tune in for the next video that I put up because actually there's another form of using temperature to help heal an area, and that is with a what's called a contrast bath. So if you're not sure about what contrast baths are, then tune into my next video and you will learn all about it. Thanks a lot for watching. If you're not a subscriber, please click the subscribe button below so that you can get more content like this, and we will catch you later on. Y'all have a good one.